Well, good morning, everyone. My name is Michael Cook.
And my name is Jenny Roberts.
We want to welcome you to this month's IHCP Live monthly town hall. So, just to give you some historical perspective, the OMPP has previously we've scheduled monthly webinars as an opportunity to give providers the opportunity to listen to all of our banners and other key updates that we provided in the previous month, and also an opportunity to ask questions and engage directly with the state. And so we're gonna try and continue that concept, but we're gonna retool this just a little bit. And we're really interested in dialogue between the state and providers around specific topics you're interested in, specific concerns that you might have that you might want to discuss a little bit more with the state and get some clarification on policy. So today we've got a few topics that we want to go through. We're actually going to start by going through navigating the Indiana Medicaid provider website. And you might be asking, well, that seems like sort of a strange topic to be going through. But there's actually a couple reasons why we picked this topic. So first off, last year we held a survey. We did a provider survey on the provider website because we were really interested in how many providers are using it, how many providers find it useful or easy to access, just being aware of the website. And what we've discovered is there's a lot of providers out there that continue to confuse the IHCP provider healthcare portal with the Indiana Medicaid provider and member website. And not a lot of providers are aware of all the different functions and resources that are available within this web page. We also did a survey on our Indiana Pathways Provider Community Facebook page. We got a lot of engagement from our HCBS waiver providers about the website, a lot of interest, understanding a little bit more about what's there, how to navigate it. So we're going to take a few minutes to actually go through, and we've got some questions, and we're going to take a quick tour around the website. We're then going to do our standard bulletin review. We're not going to go through all the bulletins that have been published in the past month, but we're going to highlight some key ones and talk a little bit more about each one. Then we're going to highlight some upcoming events to raise awareness from the IHCP. We'll go through our standard resources that are available to all of our providers. And then we will open it up for some questions, but we're also interested in additional topics that you'd like to hear about in future webinars. So if you've got any ideas today, definitely want to hear those and get some feedback so that we can prepare for upcoming webinars. So I guess, Jenny, let's talk a little bit about the websites. How can our providers really help? Let's first talk about our members. How can our providers help our members learn a little bit more about the Indiana Medicaid program? I mean, what do we have available to them?
That's a great question, Michael. A lot of providers don't know that there is actually an Indiana Medicaid website, specifically a page for members. And as you see on this homepage here, there's a member section, providers, and our business partners. What I'd like to do is navigate to the member page, if you would, please. Next slide. Upon looking at this initially, there's a lot of information. It can seem quite overwhelming. The member page has a lot of user-friendly tabs. These tabs include information for the children's programs, as well as pregnant women, the traditional Medicare program itself, Who's Your Care Connect, Who's Your HealthWise, aged, blind, and disabled, as well as our home and community-based programs. There are additional links here to help members learn how to apply for coverage, as well as how to locate their Division of Family Resources. It's really a great tool for providers to be able to help their members navigate on where to find answers to questions. Members sometimes may not know where to find a Medicaid provider. As you see in the middle of the screen, there's a Find a Medicaid Provider tab there. Members can find these links also to their rights and responsibilities. They can find a managed healthcare plan and also their NEMT authorized representative forms and additional information all on this one particular page. It's a great tool that quite possibly can be very underutilized, but as a provider, why is that important? Oftentimes, members will ask you initially for questions. You can direct them to this web page and they can get a lot of their questions answered here. There's also a contact us link here.
That's great. I mean, there's so many resources that are available, especially during the redetermination process that we restarted. I mean, there's a lot of good information about finding providers and applying for coverage and learning more about the programs. So there's a lot of good stuff about on the member side. So what about on the provider side? What can we say about that?
On the provider side as well, there's a wealth of information. Each tab has its own area. So you can see there's a provider enrollment tab, provider references, there's information on education, our business transactions, which is where you're going to find things like the financial fee schedules, code set tables for procedure codes that are covered under the particular program. Um, Clinical. There's a about the IHCP program tab and then the contact information. So I'm going to go through those a little bit based on the questions we received. One of the questions was, where can we find out how to find a provider? As I mentioned previously, there are this is located both on the member page as well as the provider page. On the member page, it's going to be found under the Resources tab under Provider Directory. But also, if you can go back a couple slides, Michael, you'll see in the middle of the page, it will say Find a Medicaid Provider. So this is on the Indiana Medicaid for Members webpage. On the provider page, it will be under the Provider Reference tab. And I think that you can also find it here, provider search, provider locator, right in the middle of the screen.
And you know what? Yeah, I don't know. You're probably not prepared for this, but I'm going to break away from the presentation. Let's pull up the website because I think there are some additional resources that we probably want to highlight, and I think it'll be easier just to take a look at the live web page. So let me pull this up real quick. All right, Jenny, so we're on the landing page. We've got a section for our members, a section for our providers, and a section for our business partners. And I'll tell you, and it's funny, but it's the number one question I think we get every time we do one of these webinars or provider engagement activities. Where can I actually find a recording of the webinars that we do?
That's a great question. The recordings for education, like we're doing today, as far as the IHCP Live, the annual seminars, if you go to the provider page,
Okay.
we are going to navigate under provider education.
Okay.
And here you will see the various areas for the provider education. You'll find there's the 2023 IHCP Works, but you can also find the IHCP Live. If you'll click that, you'll find upcoming presentations like today's date, and then the past webinars. These are previously recorded presentations.
Wow. I'm surprised we've done so many over the past couple of years. I mean, that's great. All the recordings are right there. Now, there was another item that I thought I saw at the top of the screen, which is IHCP Quick Hits. What's that all about?
Great. The quick hits are a variety of short videos for frequently asked questions. And as you see here, currently we have the Essentra Health, the provider enrollment quick hit, as well as a quick hit on navigating the website. Box 33 of the CMS 1500. These videos can outline, they're very short videos about the particular topic that has been interested by providers. And then the EVV 3D toolkit as well.
So these are just available, and if they look like they're YouTube videos, you can just click on them and get kind of some bite-sized information about a particular topic. That's great. Now, I know another big topic that providers are really interested in, want to know about fees, and I know earlier this year we updated our fee schedule because of our HIP equalization project. But providers might be interested about how that's impacting them. How do we go about actually navigating to find the fee schedule?
The fee schedule can be found under the business transaction link. If you'll go to that tab, and then let's see, I apologize. If you go down to billing and remittance, here you'll find a link to the code set tables, the IHCP fee schedules. We'll go ahead and have you click on the IHCP fee schedules. We have a link to both the professional fee schedule as well as the outpatient fee schedule. Once you click on that link, you will have to read the disclosure, the copyright agreement, and you'll have to agree to that.
Okay.
And here you can find additional links and resources. You have a list. You can download this from an Excel spreadsheet. You can also search by a particular code, which I like to go to if I'm just looking for one code. Let's pull up a procedure code 90837.
Looks like I've looked up that one previously.
You
Let's check it out.
did. And this is going to tell you the procedure code itself, any modifiers that may be used, the service category. You're going to move along and you'll see the actual fee schedule amount. There are pricing effective dates and end dates here as well. You want to pay attention to this. What are the effective dates and the end dates? Because this can show you that procedure code, the very first line, 90837, has a pricing effective date of 2/1/2015, but that procedure price ended on 12/31/2023. There is a new pricing, and that's that second line. It was effective 1/1 of 2024 for 142.78. So if you really only want to know what we pay for one or two procedure codes, you can look that up here, or you can download that in an Excel spreadsheet, the entire fee schedule.
That's great. And we've got something equivalent for outpatient services too. I saw, let me get back out of this. So there's an outpatient fee schedule.
That is correct.
Same thing, we're accepting the legal notices. And yeah, it looks like, so for every month, it looks like over the past 6 months, we will post an Excel spreadsheet that actually lists out all of the revenue codes and specific outpatient fee schedule rates for all of our services. So it's quite handy to have available.
Yes.
Great. So we post a lot of we're talking about the fee schedule and making updates to the fee schedule, and we know we make policy changes all the time to the program. So those are housed somewhere on the website, I would assume, right?
Policy changes can be found in the bulletins. And if you go to provider reference,
Okay. Oh,
the first line are about, well, we've retired the banners, but it says bulletins. And here's your reference search. The nice thing about this new tool here is you can actually search by a keyword, and you can click, you may still want to click a banner if you're looking for information that was published maybe in a banner in 2020 or something. But you can get information from the modules as well. But the most recent information on a policy change would be in the bulletins. So you can hit view bulletins. As you see, we now have a bulletin spotlight area. This is the most, well, not most recent, but several bulletins that we feel are currently being reviewed, or we have a lot of frequently asked questions through the OMPP Provider Relations inbox. And these are topics that we spotlight for changes. Here's where you're going to find your bulletins. Most recently published are at the beginning, but you can also, again, search by keyword. One thing to remember is you have your bulletin number, the date it was published, the topic of the bulletin itself, and the audience type. When it says all, this means that all provider types will be affected by this particular bulletin. If it says, just like you see in line 4, behavioral health, physician, practitioner, or other, those are that is a topic for that particular provider type. Not all providers are affected by the change.
I'm going to try this. I'm going to try this out. Let's say I'm just looking up, I got to be able to spell it correctly. Behave. There we go. Behavioral health. And look at that. So this is all of the recent publications that have come out where we have specified that behavioral health providers need to pay attention to. So that's kind of a really handy tool. I think
Yes.
this search function is relatively recent. Probably, I feel like within the past year-ish. The previous search tool wasn't quite as handy around. If you put behavioral health in, you might get a whole lot of additional stuff, but this will actually be more of a targeted search to identify the specific audiences that need to pay attention to these bulletins. So I think that's a great quality of life improvement that we tried to make.
Right.
So all of those resources are available for our providers. Find it really easily on the Bulletins update. That's great.
I would like to highlight, not only can you find it here on the website, but we also have the link. And if you can scroll down a little bit, I want to see where it says sign up to receive email alerts. You can sign up to receive these bulletins. You can do it right there at the bottom where it says
Yep.
sign up, or there's a link in the middle of the top of the page. But highly recommend signing up for these notices for your particular type of provider.
And I think we sort of we emphasize this message every time during our webinars, and I think we always make reference to scrolling down and finding that green box at the bottom of the screen, putting your email address in. But it's super important because we are constantly publishing updates through bulletins, but we're also making changes to our website. We're updating our provider reference materials. The best way to stay up to date on all those changes, make sure that you're signed up for these publication updates. Now, there's a lot of good resources we've highlighted here so far, but how about, I've got a question and I want to talk to somebody. I want to contact an MCE, or I want to contact my provider relations field representative. Where is that information located?
That's also a very great question. Sometimes I hear providers say that they did not know they had a dedicated provider relations representative at either the managed care or the fee-for-service side. So if you go to the contact information tab, it's right there at the end, right above
Okay.
your cursor. The contact us tab itself, we'll click on that. Here you're going to find an IHCP quick reference guide. I'm going to ask that you click that link for me, please. This is going to bring up a 4-page reference guide, quick reference guide with a lot of contact information. This first section is going to be the provider customer assistance line. That is the call center. Then there's the Indiana Medicaid website itself. There is a provider enrollment address, our third-party liability, and a lot more. This second section here is for the fee-for-service traditional Medicaid program itself. These are going to be where can you find who to contact if you have problems with your portal, the portal help desk. That information is here. There's the 800 number for you, as well as an email link. Verida, this is for your fee-for-service, non-emergency medical transportation. There's a member portal as well as a web page. And then page 2 through 4, these are going to be your managed care contacts. As you see, column 1 is going to be Anthem. Then you have column 2 is MHS, MDWise is 3, and then CareSource. You're going to have your different areas for your provider services, member services, claims. There's a pharmacy services area as well as dental and vision. I do want to point out, you can see in that lower right-hand corner, this actual reference is kept up to date. The most recent version was just January of 2024.
So I think what you're telling me is this is probably a resource that providers want to have handy pretty easily. Get a printed off copy, but it's also easily accessible on the website, giving you all of the contact information that you would need to help navigate the program.
Right. Michael, I see that you use a lot of bookmarks on your laptop here.
I
This
do.
is a great reference to bookmark.
I think that is great advice. Now, this isn't the only central tool that we've got around communication. I think we want to highlight one other key piece because we're always talking about, and I think you alluded to it a second ago, talking about our provider relations field representatives or field consultants.
That's right. So if you'll go back to the contact information tab,
Okay.
and let's see where it says provider relations consultants, that's the bottom tab there for you. Here you're going to find a territory map. If you want to scroll down, you're going to find the rep in the area in which you are located. As you see here, there is Indiana is divided into 5 regions for the fee-for-service program. The managed care entities, they have their own field consultants as well, and they have regions as well, but they are divided differently based on each managed care entity. There is a link directly to an email and then the telephone number. These phone numbers are voicemail. They are secure voicemail, so you can leave your field rep a voicemail and they'll get back with you. But you can see the county, your field consultant, as well as an internal consultant, and they'll be happy to assist you. If you're located in any of these bordering areas, you can see who your rep is as well. So if you're in Louisville, Kentucky, you'll see that that is Region 5. Your consultant is Tammy Foster.
It's great. Another excellent resource to have bookmarked or just know that you can get it easily accessible. You can find all these individuals because they are really, when we talk about this every month, they are the frontline individuals that can help you with claims issues, trying to understand an RA statement, adjustments that might be made, basically navigating the program. We really want this team to be utilized to help you be successful navigating the program. And each one of our MCE partners has the exact same the same group of people, not this exact group of people, but the same concept, breaking up the state into different sections with their contact information, And that's what they're there for, to help you build that relationship and to truly help you navigate the program whenever something's not quite working right, or you've got questions or clarifications that are needed. These are going to be your frontline staff that are really going to help you be successful. So I think with that, I will probably break away from the website. I think that's a pretty good overview. A lot of additional functionality that is available. Highly encourage providers to check out the website. Make sure it's bookmarked. A lot of good resources that are available. But let me go back to our presentation. And I think we had a few bulletins that we just wanted to highlight this month.
Sure. As I mentioned previously, there are some bulletins in the spotlight. You can take a peek at those, but I do want to go over a few bulletins we identified on BT 202408. IHCP identified claims for the HIP rate equalization project. Were affected by a claims processing system issue. Those claims are from data service 12/31/2023 through 1/14/2024. Those claims have been mass adjusted. Providers that have any issue with those claims, you can reach out to your provider relations team and for additional assistance if needed. In BT 202422, IHCP announced final EVV implementation timeline, and other updates are going to begin April 1st, 2024. The IHCP program will turn on the EVV system edits that activate the claim denials for non-compliant EVV personal care services. Additional information can be found in that bulletin.
And I want to jump in on that topic
Sure.
real quick. So we did a webinar on that, I believe, early last week. So I know we've gotten a couple questions from providers about that recording. That should be available by later this week. But again, we had a good time going through announcing the changes around the timeline, our new suspension process, and we also spent some time talking about reading the remittance advice, because for our waiver providers in particular, we've heard that it can be a little difficult to understand it can be a complicated document. So we took some time to break out some specific sections and highlight some key points that you need to be aware of about the RA statement. But if you're interested in that topic, again, we'll have a recording available soon from that webinar. We'll likely do additional webinars in the future on EVV. But anyway, back to you, Jenny.
Okay. All right. In BT 2024-20, FSSA announced the health plan selection and enrollment period for program pathways. And starting mid-February, members who qualify for the Indiana Pathways for Aging program should have begun receiving enrollment letters. These letters would have included information on how to enroll in Pathways, their health plan selection timeframe, and a comparison chart of the 3 health plan options. Additional information can also be found in this bulletin for the Pathways program. Anything you would like to add on Pathways, Michael?
Don't think so. Other than we haven't talked about that website, but we've got an additional entire FSSA website dedicated to the Indiana Pathways for Aging program, and that's where you're going to find policy information, timeframes, a lot of good details that members need to be watching out for in the coming months. They go through plan selection, and a lot of additional webinars that we've worked with some of our business partners putting together to help our providers as well as our members navigate this program coming up in July. So again, a lot of good information has been posted online, and we continue to post additional webinars every month, specifically on pathways.
Okay, in BT 2024-12, the IHCP changed the way FQHC and RHC billing guidance for crossover claims. Previously, the FQHCs and RHCs were instructed to include the T1015 encounter code on all professional claims. The IHCP program changed the guidelines for submitting the T1015 on Medicare crossover claims effective immediately. It is no longer a requirement for FQHCs and RHCs to include the T1015 on Medicare crossover claims only, with dates of service on or after July 1st, 2021. If you have already billed with that, you do not have to go back and change those claims.
Great.
I think that'll do it for the bulletin highlights, and so I'll let you take over for the upcoming events.
Well, we've got a couple things. Obviously, we've got a lot of activity going on with the Indiana Pathways for Aging program, but we wanted to highlight a couple specific provider relations activities that will be coming up in the next couple of months. First off, we are getting to that time of the year. Hopefully, the weather will continue to cooperate and warm up a little bit for our IHCP Roadshow. So if you're new to the Indiana Medicaid program, this is an opportunity every year where OMPP works with our business partners at Gainwell Technologies, as well as each of our managed care entities and other business partners, to go to specific sites throughout the state and actually present updates and the happenings of the Indiana Medicaid program. So this is an opportunity for us to get out and about, to interact with our provider community, to share some updates, but also to build up that relationship, to know that we're here to support you, and really an opportunity to hear directly from our provider community. So we are working on finalizing the dates and locations for the IHCP Roadshow, and we should be getting those finalized soon, and we should be announcing those in the coming days. So again, it's important to be signed up for our IHCP bulletins. That's the best way you'll find out about the IHCP Roadshow. Additionally, in likely the month of April, I think it'll be April, we'll be sending out our IHCP provider communications survey. And we've done this over the past several years. It's a good opportunity to see who is signed up for our IHCP bulletins and our publications, what you like, what you don't like. And we really do take this feedback seriously. We implemented several changes last year as a result of last year's survey, and we'll continue to make modifications based upon your feedback. So again, when we'll publish this opportunity in the coming weeks, definitely just take 5 to 10 minutes, give us your feedback. We really would appreciate it. Now, before we open it up for any questions or additional topics that you'd like to hear about in future webinars, we do like to always end these by going over some of the resources that are available to our provider community. And again, some of these today will be a little bit redundant because we've talked about them through the website, but it's always good to reinforce them. So we make available as we talked about earlier, our regional field consultants that are located throughout the state of Indiana. These are the individuals that you can contact to help with claims questions or understanding RA issues, working through provider enrollment concerns, and just generally navigating the Indiana health coverage programs. We also provide our provider reference materials, which are sort of the rules of the road of how to navigate the IHCP. All of our bulletins and policy updates get combined into our provider reference materials that are updated on a regular basis. So if you want to understand the rules of the road, if you will, at the IHCP, definitely check out our provider reference materials. And then we also post our IHCP Live webinar series, as well as additional webinars hosted by FSSA and OMPP staff. All those are available throughout the Indiana Medicaid website. Like we said earlier, it's really key to get signed up for the Indiana Medicaid provider website updates. All you have to do is scroll down to the bottom of your screen. You might actually find a link in the middle of the screen on the IHCP Bulletins page. But if you give us your email address, you'll be signed up for a once a week update that gives you all of the latest bulletins, website updates, any new provider reference materials that have been published. That's the best way to stay in touch with the IHCP. The provider relations team is here to assist you. So we have a couple of inboxes that state staff maintain, and we make available to providers to help interact with us. And we always encourage providers to work with your provider relations field representatives, both at Gainwell as well as EMCEs at first, and work through those processes if you can. But if you have additional individual provider concerns that maybe you're working through the standard process and you want the state to take another look or provide some additional feedback for you, you can contact our OMPP provider relations inbox. Equally as important, we're always looking for feedback from our providers about the presentations that we do, ideas for future presentations or workshops, general questions or clarifications that you're seeking in future publications. We love to get that feedback to our IHCP listens at fssa.in.gov inbox. As far as those provider relations field consultants, again, we talked about where those can be located on the Indiana Medicaid website, but we make them available here as a resource as well if you'd like to check them out. And with that, we're going to pause to see if anybody does have any questions they'd like to pose today, or if you have any additional topics that you'd like to suggest for future webinars, whether it's an area that you feel like the state could dig into a little bit more and provide some additional context for you, or other concerns that you'd like to address. We'll take a pause. Feel free to write it in the chat, and we'll stand by. We had a question. Could I please see the last screen? We can definitely do that. So again, don't feel like you have to take a screenshot here. You can always find this information on the Indiana Medicaid provider website. It's always available, but again, we make that available here as a quick resource as well. And while you're thinking about additional questions, if you don't have any today, again, we really encourage you to utilize the OMPP provider relations inbox as well as the IHCP listens inbox. So if we're not able to answer it today, we are going to take those any questions back or any topics. We'll get that reviewed and ready to go for our next webinar. Did have a question. If we continue to submit the T code on the crossover claims, and this is for the FQHC and RHC billing guidance, will that cause an issue, denials, etc.? Yeah, I think we'll take that back to confirm. This is, I believe that the T code is intended for identifying wrap payments for FQHCs and RHCs. So we'll take that back, but we'll take that back to see if submitting that will cause any denials or issues with the claims. There was a question. There was recently a decision made to change the implementation date from October 1st to December 1st for the new CMHW rates. Do you know what went into that determination? We do not, but we can correspond with our DMHA team to see if we can get some further clarification on that. Thank you for that feedback. We had an idea for a future topic. I would love to see something geared towards limited benefit packages. benefit plans, specifically with Package E. What is exactly considered an emergency? And then what exactly is required to bill the member for non-covered services? Great topic. We know we've gotten feedback in the provider relations inbox specifically about Package E before. We'll definitely take that down as an idea for a future webinar. Thank you for that suggestion. We have another idea. I'd like to get more clarification on non-medical transportation. Some AAA case managers approve it with attendant care, and some say it is no longer able to use in combination with attendant care and with home and community. Yes, we can definitely take that down as an idea and explore that for a future webinar. Thank you for the suggestion. We had a question. My question is around Bulletin BT 2024-11. Waiver providers are required to add a note to the claim reporting the claim, the caregiver's name, and the relationship to the patient. Do you know when this edit will be turned on? So I believe the policy update was effective March 1st of 2024, around that policy change. And I know we've received some additional feedback. So we've talked about the Indiana, the Medicaid at fssa.in.gov email address that we've asked providers if they've got, and members, if they've got any questions or clarifications about that policy change in particular, to direct those to that inbox. We have received some clarifying questions. We are working to publish some additional clarifying guidance. So definitely be on the lookout for a bulletin on that specific topic in the near future. We had a suggestion. I'd like to see information on billing preventative procedures to Medicaid secondary when Medicare primary will not cover preventative services. It's very interesting. Thank you for the suggestion. We've got that noted. I read a bulletin stating that we would have to input information on caregivers on claims submitted for structured family caregiving and attendant care. Does this only pertain to clients who have LRIs as caregivers? How will we distinguish between the two? For instance, if the client receives attendant care services and has a caregiver that is not an LRI, is there information needed when submitting the claim? Again, I'm gonna pause on that topic. We are expected to issue some additional clarification on that bulletin in the coming days. So I would pause on that. Definitely be signed up for the IHCP bulletins. I would also like information on joint infection billing guidelines and modifiers when billing more than one location, or one location is billed bilateral and the other location is unilateral. That one might be a little, we'll take that back under consideration. If you've got a specific claims issue, that sounds like it's a very detailed, specific question. If you've got a specific claims, if you're running into claims denials or claims issues around that topic, feel free to contact the OMPP provider relations inbox. I think we might be able to explore that a little bit further. We'll stand by for just another minute to see if we've got any additional comments. When we switch to the MCEs, I think this is a Indiana Pathways question. Will we be required to use the specific transportation agency, or will we be able to use our agency's caregivers to provide attendant care for an EMT? We'll take that back to explore. I want to make sure we get the right answer for you. We've got that noted. Do you have any recommendations on how to capture electronic documentation for structured family caregiving clients? Again, on anything, any questions specific to structured family caregiving, a couple things I'd say. One, definitely be on the lookout for additional publication on that policy change in the coming days. If you do have specific questions, the best place to put those, send those, is the medicaid@fssa.in.gov email box. I think I'll see if one of our team members can put that in the chat. But that's really the best place to make sure that your questions are being read or comments are being read. We've got a whole team that's reviewing those. All right, I think we've covered all of the comments or questions in the chat. So, like I said, thank you for the suggestions. Our team members have got those written down. We've gotten some of those questions that you've posed. If we're not able to address them today, we've got them written down, and we'll take them back for the next upcoming webinar. So definitely be on the lookout for additional webinar opportunities. We'll announce those through our IHCP Bulletins process, as well as our IHCP news and news announcements. Until then, we hope you all have a great day. Thank you so much for logging on and giving us some feedback, and we will see you on the next webinar. Thank you so much.